Hello, everyone. Good morning, good afternoon, good evening from wherever you're joining. Welcome, welcome. My name is Maya Goldstein. I'm the Director of Strategy and External Affairs and the Gender Lead at Impact Global Health. I'm delighted to be hosting this event today, the official launch of our newest report, looking at the global landscape of investment for sexual and reproductive health R&D, titled, "Is This a New Era?" ? For those of you who don't know us so well, we've been collecting sexual and reproductive health R&D global investment data since 2018 for a number of SRH conditions. And I should say here as a reminder, when we say R&D, we mean biomedical innovation and particularly innovation applicable to low and middle income country contexts. Last year, though, we expanded this scope quite a lot to include a number of additional women-focused, women-centric health conditions in the gynecological and maternal health space specifically. And this aligns with our commitment and our vision to expand our women's health work and to apply a broader feminist women's health lens, both within and across our global health portfolio. So I'm really excited because this report reflects this new vision and this new scope. Some quick housekeeping points before we kick off. I think everyone's muted anyway, but if you can keep yourself on mute unless you're speaking, that would be amazing. We do have a Q&A at the very end, but we also have a Q&A function at the top, on the top band. So if you can think of any questions as we go through, please feel free to add them there and we can pick them up at the end. If you have any technical issues, you can email info@impactgh.org. I think that's in the chat and someone will hopefully be able to help you. Otherwise, we are recording the event and it will be on our website later. I'm also thrilled to be joined today by my colleague, Dr. Cécile Ventola, who's our Senior Technical Officer and our Women's Health Lead. And of course, our very special guest, Dr. Nigina Muntean, who is the Chief of Innovation and Transformation at UNFPA. A quick run of show. We'll start with, we'll be kicking off with Cécile, who will give us a bit of an overview of the findings from the report, followed by some remarks from Nigina, a discussion, after which, unfortunately, Nigina has to leave us for another engagement, which is about 9:30, or sorry, I shouldn't say 9:30, about half past the hour. And then we'll finish with a Q&A with the rest of us. So I know we're pretty pressed for time, so without further ado, I might hand over to Cécile to get us started.
Thank you, Maya. And hi, everyone. Very happy to be here to present our report. So just a few words first on what is in the report. As Maya mentioned, we've been tracking data for sexual and reproductive health funding for R&D since 2018. Our historical scope was what you can see here in detail. So STIs, HPV, contraception, multipurpose prevention technologies, preeclampsia and eclampsia, postpartum hemorrhage. So for these conditions, you have the funding trends since we started collecting data in the report. We also added 7 new conditions, as Maya mentioned. So the gynecological conditions that we added to the scope are endometriosis, menopause, PCOS, and uterine fibroids. And we've also added 2 maternal health conditions, preterm labor and maternal iron deficiency anemia. So for these ones, of course, there's no trend yet visible, but there is the state of the landscape and what levels of funding and where the funding is going. This is in our report. We also have on our website individual pages for each condition, where you can find all of the funding analysis. And for some of them, we also have pipeline data that we collected independently. So for all the maternal health conditions and some of the gynecological conditions, the individual pages have some pipeline information and pipeline analysis as well. But for this launch, we are focusing on 4 main key messages from the findings for the report. So first of all, a quick comment on the general trend over the 6 past years. The funding, as we recorded, has almost doubled over this time period for sexual and reproductive health R&D. Some of this growth, about a third, is actually just due to us adding new conditions to the scope, as you can see here on the top of the caption and on the last column. But there is also genuine growth for some areas of work, such as non-issue specific funding that you have at the very bottom in bright orange. So what we mean with that is mostly platform technologies that could be applied to SRH issues, but haven't been yet. So for this, in 2023, this area received more than 200 million more than in 2018, so actual significant growth. The second biggest increase is to be seen with STIs, which received over 100 million more than in 2018 in 2023. This is coming from a renewed interest from the industry that is going mostly towards herpes and gonorrhea. I'm going to go back to that maybe in the discussion. The other conditions have received slightly more modest increase in funding, with the exception of MPTs and contraception, as you can see here, where the levels of funding have been actually decreasing, and 2023 is actually a record low level for both of these. So a general increase overall, but affecting different conditions differently depending on the content. If you go to the next slide, another big finding for our report is looking at the funding depending on whether conditions affect women exclusively or also affect men. So here in blue, you've got female-specific conditions, and as you can see pretty easily, they receive a lot less funding than any condition that is affecting both men and women. So much so that taken all together, all gynecological conditions and maternal health conditions actually receive less than 20% of the funding, of the overall funding for SRH in 2023. And actually, if we add HIV to this, we usually treat HIV in our neglected diseases report, but if we add HIV here, it's only 8% that went to female-specific conditions. So the data is showing a very specific neglect for female-specific conditions in this report. Another important finding on the next slide is we can also look at specifically where the funding is going in terms of product categories. What we see, again, for female-specific conditions is that the majority of the funding is actually going to basic research as opposed to early-stage research or clinical development. That has to do with the fact that these conditions have been neglected for decades in terms of medical research, so that we are lacking the foundational knowledge that we actually need to do product developments based on that. We don't have a very good understanding of what is going on with these diseases, so that a high level of funding needs to go to basic research first. That is a necessary first step before we can move toward next stages, but that also means there will be delays before the solutions that are needed for women suffering from these conditions can make it to the market. And last but not least, our data also allows us to look closely at funders and looking at the ecosystem. So this graph shows on the columns the number of major funders for each condition. We define major funders as providing at least $1 million in 2023. And the line that you see going up is the percentage of funding that came from the US NIH. So in terms of ecosystem, what we see here is that for STIs or HPV, there are actually multiple stakeholders, and the dependency on US NIH funding is under 40%, so it's not so high. As opposed to our female-specific conditions, again, where there the ecosystem appears to be much more fragile. The investment from industry is much more limited to start with. It's only 2%, but also it's highly dependent on US NIH funding. So across gynecological and maternal health conditions, 77% of the funding is coming from the US NIH. And as you can see on the right side of the graph, for some conditions like endometriosis, preterm labor, uterine fibroids, this is above 90%. This makes it pretty fragile because that means if there were any change, any decrease actually in the levels of funding from the US NIH for any reason in the coming years, that could prove catastrophic for the sector if it's not compensated by other stakeholders. But as you can see on the graph here, other major funders are limited for these conditions, and actually across all female-specific conditions, there are only 6 other public funders that contributed more than 1 million in 2023. So that means that overall, in order to boost forward progress, we don't need more, not just higher levels of funding, but also a diversification of the stakeholders to make it more sustainable. I think that's it for the major findings, and we can now go into the discussion.
Thank you, Cécile. I'm sure we all have a lot of questions, so keep those in mind and pop them in the Q&A as they're coming up. But first, I do want to hand it over to Dr. Nigina Muntean to offer some reflections, especially as someone who's working so deeply in this space, in the women's health innovation space at the moment.
Thank you. Thank you, Cécile. Thank you, Maya, for inviting me, partners, all who joined to listen to that. It's a pleasure to be here, and thank you for Impact Global Health overall, and also for the Gates Foundation to supporting this important work. I think this report is more than just data. This is a powerful diagnostic tool for all of us, eye-opening, revealing the system forces that actually shape and often, unfortunately, distort the funding landscape for the sexual and reproductive health. And that report, let me say, doesn't just track money, funding. It tells a story. A story we recognize deeply at our work at the United Nations Sexual and Reproductive Rights Agency, UNFPA. And as you mentioned, the funding has nearly doubled since 2018, but look beneath the surface. The picture is much more complex and I would say more concerning. The dramatic rise in funding for sexually transmitted infection, for example, is driven by private sector interest in high-income markets. While contraception, one of the most essential tools for bodily autonomy, has fallen to its lowest level in recorded history. This deepens inequity for women and girls in low and middle income countries, and we know the unmet health needs are limiting education and economic opportunities and actually perpetuating the poverty cycles. So this is not really helping them to progress and prosper the way we want to see them. And from over 800 research in development projects active in 2024 between the 20 most influential pharmaceutical companies in the world, only 3 focused on maternal and newborn health. And this is why we all know that every 2 minutes a woman dies from pregnancy-related causes. And it's about 800 a day, which is like unbelievable in our modern days. Abortions are only 1.1 million last year. I think it's the lowest of any area tracked. And allow me to remind you that UNFPA report states that nearly half of pregnancies globally are unintended, and over 60% of unintended pregnancies end in abortion. So, and this area is so underfunded that women are lacking the options, the choices, how to really have a control of their life. This is despite the fact that every dollar spent on closing the global unmet need for family planning yields at least $8.4 in return of investment. For conditions affecting exclusively women, like a polycystic ovary syndrome, endometriosis, or fibroids, investments is still stuck in basic research. Women are losing their productivity, losing the quality of life years spent, and it's not only that. These issues, which concern half of the world's population, remain excluded from up to 70% of internal medicine's residency programs. Doctors simply don't know oftentimes how to identify or treat these cases. Another reminder, the burden of benign gynecological conditions is greater cumulatively than all of malaria, tuberculosis, and HIV combined for women and girls of reproductive age in developing countries. So it still like beyond imagination why it is so neglected, both in terms of focus, attention, and funding, when there is a clear economic benefit and also social moral imperative to invest in that. So we see the contrast, we see imbalance. It's not just inequitable distribution of resources. It's a missed opportunity for millions of women and girls and the economies they live in. And equally concerning is the fragility of the funding base itself. As you noted, in 2023, just 3 funders accounted for over 80% of all global SRH research and development, just 3. And one of them, as we know, is kind of in a more challenging situation right now, so which leaves us with just 2. This is the half of the population. The current pace of disbursements will only take an estimated 350 years to provide the necessary resources to achieve the goals which we are trying to achieve in terms of maternal health, family planning, and also gender-based violence, which also affecting a lot of 1/3 of women actually and girls globally. All this sheds light on a system that remains riddled with gaps, distortions, and blind spots, leaving the needs of women and girls unmet in both high and low income settings. So it's not only the problem of developing countries, it offers a precise data-driven diagnosis, the report, and with that, the tools to reshape the system. So when we know where a problem is, we also are better equipped to come up with recommendations. And I think in terms of the way forward, based on the findings, I think first we must change the incentives. The current research and development model doesn't really work for women and girls as an incentive for those who are investing in it. It neglects the market failures that affect gender-specific needs. It also undervalues innovation that would transform reproductive freedom and health. Second, I would say we must redesign the architecture of innovation itself. Gender equity cannot be an afterthought. It must be integrated at every stage, from research priorities to clinical trials to investment vehicles, and really starting from data inclusivity from the day one of conception of those phases. And third, we need better risk mitigation. With such extreme concentration of funding, the data makes it clear we must actually diversify the base with catalytic capital, pooled funds, blended finance that enable innovation to survive and thrive across different geographies and income levels. I think collectively, we are creating a pathway to de-risk, redesign, and deliver, and that's what we also do at UNFPA as part of Equity 2030 Alliance, where the Impact Global Health is the key member, and we really value your membership and collaboration with us. Together, we can turn this data into disruption, a positive disruption. Let this report not just inform our discussion, but also ignite the change we owe to women and girls everywhere. Thank you.
Thank you so much, Nigina. You covered a lot, and there's a lot to unpack there. And I'm really keen to ask you both some questions. So if it's okay, I might just jump straight in. And I might start with you, Nigina, and pick up on one of the points you raised in your reflections about the current environment and policy shifts. So we called our report a new era ? And quite intentionally, because we felt that just as the sector was building momentum and support and interest and funding even for women's health, earlier this year, kind of overnight, the landscape changed. And with it, a receptiveness and recognition of women's health and gender responsive research in general. How have you observed these shifts in support for women's health, personally, professionally, specifically in the women's health innovation space? And where do you think the sector needs to focus to ensure that we have the right investment and resourcing to fund the innovations that women really need?
I would say we're witnessing both momentum and fragility. So it's happening at the same time. On one hand, global attention for the women's health is increasing. We see more publications, more reports, more data, which is great. But at the same time, the ecosystem remains dangerously thin and undiverse. So most funding is derived from a handful of dedicated donors. I would even say in terms of the public sector, if we look at the governments, we also see that the landscape is shifting, the priorities are shifting, so the support is shifting as well, which does result in funding as well. So that leaves the system exposed to shocks from political and philanthropical shifts, and this is what we see, and especially in UN, as you know, at the moment, it's really shock and shift what is happening, and just the recent loss of funding to UNFPA left over 12 million of women and girls deprived from the access to essential services related to their health. So really that is happening, and to build the resilience and unlock scale, we probably can see it in 3 critical shifts which should happen to make us more resilient to such shifts. And first, we must position women's health innovation as a top-tier investment class, not as at bottom of the pyramid, not as a nice to have. And the data is clear that closing the women's health gap could unlock 1 trillion of GDP annually by 2040. And that's probably a minimum kind of modest projection. And it can avoid nearly 27 million of disability-adjusted life years each year, generating at least 3 dollar return for every $1 investment. This is the data. This is the projections based on really data. And we must articulate that return of investment in terms that resonate across sectors, from health economics to the sovereign investors, from public to private sector. Second, I think we must diversify who sits at the innovation table in discussions. Despite the enormous need, over 75% of clinical trials for key women's health conditions still occur in high-income countries, which means that the women in low and middle-income countries, and they constitute 50% of the burden, but they're not part of the data set. And that means their needs are not always equitably included into those discussions and the data fundings. And the assumption doesn't work. It should be inclusive. And third, we must expand financing tools to reflect the real world barriers to scale. And we need to understand those. Less than 10% of pipeline solutions mapped in the Women's Health Opportunity Map report that were deemed scale ready, largely due to fragmented R&D, inadequate financing pathways, which enable scale, and weak adoption frameworks usually act as the barriers. And this is a market shaping problem, which we need to address. It's not just a funding gap. And ultimately, we want to mark this as a true new era, not question mark. We must finance women's health like we mean it. It's not a niche, it's a necessity. And that's how we should address it, from anything like economic logic, equitable innovation, and world blended financing and partnership. Thank you.
Thank you, Nigina. I absolutely agree, especially on that last, well, all of it, but especially that last point about it being a market shaping problem. I mean, we're not just falling down on the innovation, it's on the implementation and the scale up, and it truly is an ecosystem problem, an ecosystem issue. And yeah, and I guess that's where we need to be looking in the future. I think it's probably a good segue actually to my question for you, Cécile, next. I mean, it's probably quite shocking, but very unsurprisingly that women-only health conditions receive the lowest of the low. And as you said, the further away you get from things that affect men, the less funding they receive. I think we probably all know why this is, but I mean, maybe you can offer some reflections on why this seems to continue to persist now, even in the face of such momentum around the gender gap in health. And what angles do you think we need to take to make the case that women-centric conditions also are worthy of attention?
Yeah, thank you, Maya. I mean, I think it's some of the main aspects of this actually have been addressed a lot by Nigina in her remarks, but a lot of it is legacy from decades of gender bias in how we're looking at health and what is getting attention and what is getting funding and what is getting published. So for female-specific condition, that means lacking some basic knowledge on them, but even for non-female specific conditions, we've mostly been looking at how these conditions affect men and how we can treat men for them. So there's data gaps all over. But I think the momentum that we currently see happening is sort of trying to disrupt this is coming from advocacy, should be said. It's not coming from what's happening in the decision rooms. It's actually advocates from the outside that are making these conditions more and more visible. But even then, there's a lot of momentum around endometriosis at the moment. That doesn't mean we actually understand the condition because we have decades of neglect to compensate for. But something that I think is one way of changing sort of the narrative around that is to try and change the narrative that says that this is a niche interest, that women's health is a niche aspect of medical research in general and R&D development as well. It is actually an untapped market with half of the population, and Nigina also gave us very interesting numbers in terms of not only how many women are affected, but also in terms of economies, like what it could bring. And there was also this report by McKinsey last year that showed that it would be not only an actual smart investment for investors themselves, but also that all the societies would benefit from women being able to be in better health. So maybe it's around that narrative that we can try and shift things, but efforts are going to be needed in every direction because the problem is really multifaceted.
Yeah, totally. I know we have only a few more minutes rather for you, Nigina. So I might squeeze a few more minutes out of you. And I know we've been talking about a lot of doom and gloom because there is a lot, but there is also some good news stories. And even in our report, as you mentioned, there's been some increase in STIs. And also some increasing funding for maternal health issues, which have been traditionally neglected, like in preeclampsia. what other good news stories do you want to sort of conclude with now in the areas of women's health innovation at the moment?
Thank you. And I think, yeah, it's a momentum also, as I said. So, and the report highlights it gaps, but we're also seeing the breakthroughs through celebrating. And I actually would mention some which might see like not a moonshot, but roof shot, low key innovations, low resource innovations. But because myself, I worked as a medical doctor in really low resource settings, I know that these are the really breakthroughs because they really have a potential to save so many lives. And for example, take preeclampsia. Investment in predictive diagnostics and affordable interventions in low-dose aspirin protocols are gaining traction, and it works. And actually, it has a enormous potential because you can access aspirin like anywhere, and you don't have an expensive equipment or diagnostic tools to do that. So we also see more scale in low-cost innovations like, for example, the dual HIV syphilis rapid test, which is now the cost is reducing as well due to also funders and investors, but also calibrated drapes for the postpartum hemorrhage, the self-care products like self-injectable contraceptives, HPV self-collection, simple telehealth solutions, digital health. Some of these we're scaling now through WomenX Collective, the new UNFPA program, and some of these are scaled by other partners and funders. And I think that's amazing because they have an enormous potential. And I think when we talk about can be AI, like AI diagnostics and menstrual health solutions, or a really new novel ways to stop postpartum hemorrhage or diagnostics, some of them are also outlined. I think 50 real-world innovations were outlined in Women's Health Innovation Opportunity Map led by the Gates Foundation, and they're really amazing. So if investment goes to those pipelines, we have a potential. And it also modeled, the map also modeled that about 300 million in R&D could yield 30 billion in economic returns, 43 times multiplier. So let's talk about market dynamics. The overall women's health market is also projected to grow from 97 billion today to 1.2 trillion by 2030. That's not the niche, obviously. It's the next frontier. And I hope investors and funders hear us and help us to accelerate what's working. It's not a question anymore, innovation or no. The question is, are we ready to back it at scale?
Thank you for that. I completely agree. And I think this point about it not being a niche issue is so important. I think some of the most effective shifts have been around changing the narrative to build a stronger investment case. And I think actually all the data is here. This is a strong investment case. And we just need to move that forward and take action. Thank you so much for your time. I have so many more questions for you, but we really appreciate your time today and we loved having you. Thank you so much, Nigina.
Thank you. Pleasure to be with you.
So with that, I'd be keen to hear what the rest of all of you who have joined us today think of the report, and I'd love to open the floor for some Q&A. I have not been looking at the Q&A function, but I'm going to have a look now and see whether any questions have come up. But if you'd also, I'd like to, someone has asked if we could, yes, you can have, I'm sure we can get Nigina to share with you her facts and figures, absolutely. If there are any questions, please pop them in the Q&A. Also, if you want to put your hand up, I may be able to see you. It's a little hard to tell. If not, I can maybe kick off with a question for you, Cécile. Yeah. And looking a little bit more at the data that we have. I think we've mentioned a few times that funding for STIs has increased quite a lot, and we reflect in our report that this is probably due to an obvious dual market for these products. And I guess in theory, dual market spillovers like this aren't a bad thing, but we do have some concerns, and I think it'd be interesting to hear your thoughts on what we think can go wrong when we don't focus on the needs of lower middle income country markets, specifically in the R&D journey.
Yeah, sure. Yeah, as a matter of fact, we saw that STIs were the second category to receive the most increase in funding over the last 6 years. And that's actually really good news for some of these STIs receiving that funding. So it's mostly herpes and gonorrhea, probably linked to the AMR risk of gonorrhea. And we definitely need research there. So it's great that it's happening. And there's a potential for spillover, as you were saying. The perception of a market in HICs can lead to the products that will then be accessible as well in LMICs. But that's exactly the condition that needs to be respected. Will they be accessible or not? There's, of course, a cost question, but also making sure that the products that are being developed are appropriate for low resource settings. So there's issues to take into account, like do they need cold chain storage, or are they heat stable so that they can be accessible everywhere? Do they need skilled administration, or can they be used just by the user or by community health worker, for example? So there are things to be taken into account. And of course, when products are developed with HIC markets in mind, that's not always frontline, of course. And also the perception of a market is not making room for needs that are specific to LMIC context, but that are really necessary to take into account. So when it comes to STI, for example, there's a need that is specific to LMICs, which is for point of care diagnostics. It's not really needed in HICs because most testing happens through lab facilities. But yeah, in LMICs it's needed, and the level of funding for diagnostics is actually going down from our data. And that's essential not only so that people living in LMICs can get tested and treated, but for example, with bigger, wider issues like AMR, diagnostics are really important so that we don't prescribe antibiotics when they're not needed. Also diagnostics to be able to detect resistance and actually try and curb what's happening in that space. So it's not just LMICs, it's also the global issues in general. But just going with like private market interest, of course, doesn't always cover everything that is needed.
Absolutely. Thank you. And that was a really comprehensive answer. I might ask you another question then on the data, some of the trends. So while we're seeing STIs increase, we're seeing funding for, like Nigina mentioned, there's funding for contraception going down to one of its lowest levels since we've been collecting data. This is kind of worrying because there is such demand for contraceptive methods, and particularly those that really actually meeting the needs of women and men in terms of user-centric design and on-demand methods, etc. Why and how do you think we can keep the momentum for contraceptive R&D going? And why do you think the contraceptive R&D is still necessary today?
Yeah, it's a very good question, because I think for some people it might actually be difficult to understand that we look at contraception as if there were market gaps, because they are, but there are such a wide range of options available that if you look at it from a purely disease medical point of view, well, there are solutions out there. But the first point to respond to that is the fact that contraceptive efficacy really depends on how well the product works with users' preferences and limitations sometimes. And that is why we need as many products as possible. So the more diversified, the better. And so we need more R&D to have more options. And also, as you were saying, products that better meet the user's preferences. And so the kind of demand that is emerging is, as you were saying, user-controlled options, non-hormonal options, male contraceptive options. And for this, we still need a lot of R&D because these options don't really exist. How to keep the momentum around this? I think it's also here again a question of maybe updating the narrative around that, rather than seeing it as like a medical problem, a disease with one solution, is to see it as again an untapped market where it's about consumer products. It's about making sure that they meet a wide diversity of needs. And that actually, if we were to look at it in this way, maybe it might become clearer that it is a market where there would be demand for many different products rather than just one solution. And if I may, I will maybe connect it to the multi-purpose prevention technology angle, where most of these products are very early stages in their development, but it's also not really perceived as a potential market, even though when we're thinking about these products, they're often user-centric, they're often non-hormonal and offering double protections against pregnancy and some STIs. There will be undoubtedly a market for this, but it's not really being perceived as such. So it's maybe about reshaping all of that conversation around these products as not just a medical issue, but also a consumer market.
I think that's actually a nice, thank you for that. And that's a nice segue to a kind of question that we've got from Monica Kerrigan. Great presentation, thank you. Are there governments and private sector in the global south that may be interested? And how do we crowd in more funding and new investors? I think that's a very existential question about the latter. How do we crowd in more funding and new investors? But I certainly think that there's dialogue and narrative and momentum at the moment to be looking elsewhere at new funders, diversifying funders, new funding mechanisms, and a new funding ecosystem for global health more generally. And so from my reflections, while I don't have I couldn't say, yes, this particular person and this particular place, I think I'm really excited right now, even in the face of all of this uncertainty, that there is momentum and fire in the sector for people to be working with new partners, looking to different places to find solutions and to, I guess, recreate the global funding ecosystem for women's health. I don't know if you have any reflections too, Cécile, on that.
No, I completely agree. Maybe what I would just add is sometimes sort of what is missing is making the case to, as you're saying, there's potentially funders that have never looked into this, that are sort of unaware, also due to this bias that we've been living with forever. They're not aware that there's untapped markets there. And if we are able to provide them with the narrative, with the potential return on investment, that might really change things, and not just out of a moral obligation, but also out of, this is actually something that would be profitable privately and for societies. So maybe that's also where we can make some change happen.
There's also another sort of question from Megan Christerfield. Would love to collectively problem solve how we can better articulate the value of these upstream investments. I think it's clear in our bubble, but many folks don't see it that way. Can we tell the R&D investment story as some of the products that folks most use today? I think it's actually something that now we just sound like we're plugging ourselves, but this is actually some work that we've been doing quite a lot at Impact Global Health, which is articulating the health and economic impact and the return on investment of investing in global health, but not just as a global good, but actually as a domestic return for high-income countries. And I think maybe that alludes to some of the point that you're making, is that people in the global health space, people in the women's health space know why these are good investments, but others don't see it, and it's not in their periphery. So I think, tying those stories, like you say, back into the things that people see in front of you, what you're using, what's important to your life, as well, and linking that to the benefits of these types of global health investments and these types of women's health investments is critical, and is definitely an avenue of research that we've been exploring quite a bit. I'm not sure if there are any more questions there. We only have a few more minutes, but maybe I can be really sneaky and ask you one last one, Cécile. Which is a nice wrap up, because I think everyone in our bubble here knows that, women's health is everything. It's not just sexual and reproductive health. It's not just reproductive health. It's things that affect women exclusively, disproportionately, differently. We're familiar with that narrative, but it is basically everything. So what reflections can we offer on how we can prioritize when women's health is so broad?
I think that's a really good question, and a really difficult question to answer as well. The answer that comes to mind is to maybe not think of it as like there's something to be pushed further first, but more that it's a multifaceted problem. As Nigina was saying also before, like it's at every level. It's what research questions are being asked, from what kind of data is collected in clinical trials to where is the funding going. And so rather than thinking that some things might be more urgent than others, it's more looking at like there's actually efforts that can be made at every level. And isolated. We can all coordinate and be aware of each other's focuses, but then actually be all collectively working toward the same goal. But that means also, yeah, that there's action that can be made at every level so that changes can happen little by little. So whether it is like making sure that there is sex desegregated data for this specific clinical trial, or making sure there is some funding going to a neglected maternal health condition, for example. And so we all have a role to play. And I guess events like this one are also opportunities to feel connected in the different ways that we approach the very same problem.
Couldn't agree more. And thank you all of you for coming. I guess we're almost out of time now. And so I'd like to take these last few minutes just to remind you where you can find all of our reports and data, which is, of course, on our website. We also have a women's health hub on our website, which is a particularly good start. There you can find all of our reports and also links to the GFinder data portal, which is the platform which houses all of our global investment data and is an interactive way to create your own visualizations and interact with the data. I'd encourage you to follow us on social media so you can stay tuned for upcoming launches and new reports, which is a nice segue to also plug the fact that we're very excited that we have 2 additional women's health, sexual and reproductive health reports in the pipeline. One that's going quite a deep dive into the landscape of innovation for gynecological conditions, PCOS, endometriosis, and uterine fibroids, and another looking at AMR risk STIs, and we'll be releasing those over the next few months and the rest of this year. So do sign up for our newsletter because you'll be able to get them directly in your inbox and also find out about how we're socializing and releasing these. Of course, for anything else, please do reach out to us. We'd love to keep the conversation going. And with that, on time, it's been really lovely having you all. Have a really wonderful rest of your day, and thank you all for joining. Bye.